Yeah, I just got out of the hospital on Tuesday, and it's my Aetna app is saying that I had a prior authorization request for my hospitalization that was denied. And I'm wondering why, because my kidneys were failing. So,
This breaks my heart.
hello?
Yes, I'm checking.
Okay.
So the denial reason was that you didn't meet the requirements for coverage.
I mean, I wasn't really even given a choice to be hospitalized. I mean, you know how that goes, right? You go into the hospital, they tell you you're sick, you have to spend the night, right?
I see here that there's a peer-to-peer offer. That is an opportunity to the provider contact and schedule a peer-to-peer and provide all the necessary information about the medical necessity.
Okay. Is that like already scheduled, or is that something I have to try to arrange?
So that is the doctor.
So if I went into an emergency department and I was admitted to the hospital, I saw like 8 doctors. Who's the doctor that does the peer-to-peer?
He is the provider on the authorization, so he is the one who needs to make the peer-to-peer.
Okay, I'll see if I can fit. He's a hospitalist, so I mean, he doesn't work at the hospital full time. So I mean, I have no way to contact him. Is it a nurse that makes this decision?
They don't even have a phone
In
number.
this case, is the peer-to-peer option.
So a nurse never looked at this?
She doesn't know.
Yes, it did, but again, they only determine a decision with information they have. That's why they are.
I don't believe her.
I understand. Can I speak to the nurse? Can I speak to the prior authorization nurse that made the decision
They don't have a phone number.
and provide more information?
Number for them.
They said that I could call and try to set up a peer-to-peer, and I don't really know how to request
Her
that.
health. And there's no phone number
Anything we can do on our
to
end.
escalate.
You do receive a bill from us for the state of service. You can always call in
They don't
and
care.
see if there's anything we can do to help you get that covered by insurance.
I'm
Okay.
so sorry.
But as of right now, it's just something we can do. Thank you for calling in. I hope you have a great day.
We don't have the numbers yet, but your health insurance is going to go up.
Mm-hmm.
We're trying to minimize the damage, of course, but do be prepared to pay more next year than you paid this year.
My husband and I are both self-employed. In my other job, I'm self-employed as a therapist, so I don't have insurance options. My husband doesn't have insurance options, so I worked a job essentially just for the insurance, and then they cut me out my hours down to part-time. I looked at the marketplace today, and we don't qualify for any subsidies. So insurance for our family of 5 would be $2,500 a month. I'm not paying $2,500 a month. I'm fine paying cash because we don't go to the hospital, but I looked at a hospital catastrophic plan. I don't qualify because we make too much money. I have no idea what to do. So find me working at Starbucks 20 hours a week with a master's degree because I need health insurance.
Wow.
Our family will not be enrolling in health insurance this year. Nada.
Amen.
I had a hysterectomy in April. I started seeing my gynecologist last September, knew that this was the plan. I have 2 insurances. One is Cigna, that is my employer provided health insurance. I pay $76 a month just for myself. If I were to pay for my family, hence why we have the second insurance I got through the marketplace that is Better, so I am double covered. Okay, in case you did not know,
They go to war at each other.
this is for you insurance people because this is why I'm mad.
Mm-hmm.
Cigna would be primary. Why? Even if you had Better longer, it doesn't matter because it is a government subsidized individual healthcare plan. Employer plans are always before the government subsidized plan no matter what, okay? Had the hysterectomy done in April, I had to call and do a coordination of benefits once. I already had to do this. I had the hysterectomy in April. They called me in June and needed me to do a coordination of benefits and tell them Cigna is primary. Dealt with it. It's been handled. Get a call this morning from the gynecologist's office that Cigna is now calling and wants their money back. They want my gynecologist to send the money back that they already paid because they're saying again that Better was primary because I've had Better longer.
I told you.
I've worked in
They
insurance
war
for
against
a
each
hot
other.
minute,
I've
and
been
I am
there.
currently finishing my medical billing and coding degree, and let me tell you, I was ready to make the phone call and go to war. After an hour-long wait, I still haven't spoken to anybody. I had to call Cigna, and then they had some secondary company called like Coventry or something like that that they had to call and argue with. And they said, oh, there was a lapse in your coverage, it looked like, back in May of last year, and so you've had Better longer. And I said, I left my job for a month and I came back. But it doesn't matter how long I left. It doesn't matter if I've had Ambetter for 10 years and I get a new job and I go have a procedure done and I now have Cigna. Cigna is always going to be primary. Always, always, always. There's no if, ands, or buts. You cannot use that. The only way that rule stands is if I had 2 commercial insurances or 2 of the government subsidized insurances. So if I had like Medicaid and Ambetter, it's whoever you have the longest. If I had Blue Cross Blue Shield or United Healthcare, it's whoever you've had longer. But in the instance of a job provided insurance, a commercial insurance like Cigna, and then you have a government subsidized Ambetter, the Cigna is always first. Okay?
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family, correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks.
What in the world?
Oh
That
my.
does not include
That's horrific.
my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage?
That's a whole paycheck for at a
Just
2
in
week
medical
span.
coverage. They already kicked our spouses
The government
off of our coverage because they said
employees
your spouse can get
is
insurance through
over.
their job. We're cutting them off. So not only did you cut them out, it tripled.
It tripled.
$700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly.
Government.
How is this? And I work in medical.
It looks like it. I see your blue.
How is this fair? How does
This is
work for me?
horrific.
I
We have to
literally cry.
fight this.
I have a daughter that's graduating college next year. I have a daughter that's getting married next year. On top of that, we have to live.
That's why the
How?
Democrats won't cave. This
How?
is
How can anybody
this
live
is
spending just
impossible.
$200 a month just in healthcare that doesn't cover our dental, that doesn't cover our vision.
And your other lights,
On top
gas,
of that,
housing,
there's a $2,000
food.
deductible and a 20% co-insurance. So either way,
And then
anytime
office
we go to the
visits.
doctor, anytime we do anything, we gotta come out of pocket.
Yeah.
On top of what I'm already paying. When in the fuck is this nation supposed to be great again? Because it's getting worse.
Oh, you believe that?
Situation is sad. Our health insurance en masse. I want you to stop and really think about that, because when you break it down, the entire concept of modern health insurance in America has become a form of state-sanctioned financial abuse. Most of us are already stretched thin, some to the breaking point, paying through the nose for shit-tier coverage that seem designed specifically to avoid paying for anything. You're hemorrhaging hundreds, sometimes thousands of dollars per month from your paycheck. And for what? For the privilege of having a $8,000 deductible? So if you get sick or break a bone, you still end up with a 5-figure medical bill because the ambulance was out of pocket and the anesthesiologist was out of your network and the hospital doesn't take your specific type of plan. Spend the entire year paying for nothing. And then the clock resets on January 1st and you get to start the whole financial grind all over again. If you think it's bad now, buckle up, because we're headed off of a cliff. Premiums are already projected to skyrocket 15 to 20% on average. That's baseline increase. Now layer that on top of the Republican Party's goal to dismantle the Affordable Care Act, obliterate the subsidies that make insurance even remotely accessible for millions of people. They get their way at the end of this government shutdown. We're not talking 20% increases. A lot of people's premiums will triple or even quadruple. Average total annual cost for a family of four's employer-sponsored health insurance is projected to be nearly $27,000. For a family buying on the marketplace, you're looking at an average premium of $950 for bare bones bronze plans to over $1,300 for a gold plan. And that's before you even step into a doctor's office and start chipping away at the deductible.
This
Now,
is
I ask
insane.
you, is the average family of four without any major chronic health conditions using $27,000
Never.
worth of medical services every year? They getting $27,000 of value in their care? I fucking doubt it. Entire model is built on the healthy minorities subsidizing the system, while the insurance companies skim a massive profit off the top and fight tooth and nail to deny as many claims as they can. It is, in its purest form, a scam. The cost of prescriptions are a scam. The billing is a scam. It's all a house of cards built on our participation. This entire multi-trillion-dollar system cannot survive without our money.
That's
A
right.
critical mass of people stood up and said,
No more.
And canceled their policies in a coordinated
That's right.
financial defiance. The system would implode very quickly. And that implosion would force the system to operate differently. Already seeing a rise in concierge medical services and subscription-based medical services. Doctors and hospitals are often just as trapped as we are. Insurance companies don't just screw the patients, they screw the providers as well. They dictate what a procedure can cost.
How
They
long
force
you can
doctors
be in
to
your
accept
visit with
reduced
them.
payments,
Reduced
and then bury
payments.
them in mountains of bureaucratic paperwork.
We're just
An
numbers to
independent
them.
practice is forced to slash the price of a service just to be in network. What do you think happens? The doctor has to see more patients in less time to keep the lights on. It becomes a revolving door. You get 5 minutes with a physician who is staring at a computer screen, not you. And then the quality of care plummets because the entire profit model is perverse and broken. Insurance companies
It is not
have
of God.
inserted themselves as a necessary parasitic middleman, making themselves rich by making both the patient and the doctor more poor and miserable. Our collective financial power is our ultimate leverage. It's the same principle as the mass cancellations of Disney and Hulu that brought those corporations to their knees
Yes.
when they overstepped. They cannot run these insurance scams without our premiums.
And we're
Our
watching
money
you
has
too,
always been,
Netflix
will always be our
and
power.
Peacock.
Our compliance is their fuel. If
Get
we
greedy,
collectively pull
and
the
we'll
plug
can
on
y'all
this
too.
extortion racket, we can force a seismic shift. And if
Get it? And not that I didn't know people did that for a reason, but what are our options? I don't know.
So I just went online to check my health insurance, and my current premium right now is $292 a month. Starting January 1st, it's going to $450
Of 2026, that is.
That's almost as expensive as my car note.
So what would be your take-home pay? People, we must come together and
So, like, what are we doing?
have a solution.
What are we doing?
We're going to do something. We're going to
My
stop.
health insurance is around $550 a month for just me. And I'm really thinking of taking myself off of health insurance. With my car insurance, if I get into an accident, I have PIP. And I feel like paying out of pocket for like the occasional blood work or medication that I need is appropriate. At this point in my life, I've resolved a lot of my health issues. And I feel like right now I'm still paying out of pocket for like a doctor who doesn't take health insurance. And I really just have health insurance for like peace of mind. But at this point, I'm just kind of like $550, and that's not even like, that's the beginning. That's like what, almost $8,000 a year. It's just so
That's
much, and I want to be able to spend
horrific.
that money either in savings or investments or other places. But $550 for bare minimum stuff and for care that is just symptom treating and not preventative or anything else like that seems kind of crazy to me. So if you've taken yourself off of health
So
insurance and you
listen.
don't have health insurance and you're just paying things out of pocket, I would really love to hear your perspective. If you have done that and you regretted it, please let me know as well.
Who makes $82,000 a year, it's going to cost $754.
It's talking about health
Last
care.
year, that was $167. And for a couple in their 60s in Prescott who make $54,000 a year, their health care is going to cost $878, where It was $154. Those are huge increases, and for many people, it's unaffordable. We're trying to fix this. We are standing up for what's right. We're trying to reduce your healthcare costs. Unfortunately, my Republican colleagues wanted to give a big giant tax cut to rich people, and they're paying for it partially by raising the cost of your healthcare. That's what this fight is all about.
By 18% for the rest of the year. Now, a lot of people are like, oh, it's not that much, you know, that's not that bad. In 2026, when the subsidies go away because of Trump and his big, beautiful bill, health insurance premiums are going to be 118% more than they are right now.
And a deductible in the thousands of dollars.
Insurance plan in 2025, it's going to cost you around $950 or so on average. In 2026, when you try to get a health insurance plan on healthcare.gov, your premium will be around $1,900. So people are then going to have to decide, do I want to pay my mortgage or do I want to have health care?
My Lord.
It's fucking crazy.
Healthcare is a right. It should be guaranteed. Everyone should have health insurance or healthcare provided through the government, through the public sector, completely funded, just like Social Security, Medicare, Medicaid. And that should extend to everybody. You shouldn't have to go on the Affordable Care Act website and pray that you can afford a public plan through healthcare.gov, and also pray that that plan doesn't increase by 20 to 30 to 40 to 50% in price because Congress refuses to continue to improve your health care.
We dropped our health insurance for 2025. I've seen a lot of people are considering that for this year.
This is great news. Listen.
And I know that's really scary. Let me tell you what we did. Let me give you just a few tips that will make your life easier if you decide to go this route. Step number 1 is find a direct primary care clinic in your area. We pay $265 a month for all 7 of the people in my family to have direct access, 24-hour text access, call access. All of our visits are covered. Telehealth is covered. Yearly labs are covered. Basic testing is covered. We pay that to a direct primary care clinic.
You a bad girl and your friends bad too. Oh, you got the swag sauce, you drippin' swag goo. You a bad girl and your friends bad too. Oh, you got the swag sauce, you drippin' swag goo. Oh.